Chronic pain is a widespread issue, affecting over one-third of people globally and often lasting more than 3 months. It can severely impact daily life, mood, and physical function. While antidepressants were originally developed to treat depression, research has shown they may also help manage chronic pain. Different classes of antidepressants such as SNRIs, TCAs, and SSRIs have been studied for their effects on pain. This video explores the latest evidence from a comprehensive network meta-analysis, which compared the effectiveness and safety of various antidepressants for adults with chronic pain. We'll look at which medications show real promise, what the evidence says about their benefits and risks, and what this means for people living with chronic pain. Major review included 176 studies with over 28,000 adults, examining how well antidepressants work for chronic pain. The most common conditions studied were fibromyalgia, neuropathic pain, and musculoskeletal pain. Among all the antidepressants tested, duloxetine stood out as the only one with moderate to high certainty evidence for reducing pain and improving physical function. Standard doses of duloxetine, 60 mg, were just as effective as higher doses, providing substantial pain relief for more people compared to placebo. Milnacipran also showed some benefit, but the evidence was less certain. For other antidepressants like amitriptyline or SSRIs, the data was either inconclusive or of low certainty. Most studies were short-term, and many excluded people with depression or anxiety, which limits what we can say about mood improvement. When it comes to safety, the evidence is much less clear. The review found very low certainty for all safety outcomes, including adverse events and withdrawals. This means we can't draw strong conclusions about the risks of using antidepressants for chronic pain, especially over the long term. Most studies were short, lasting around 10 weeks, and didn't include people with both chronic pain and depression. As a result, we don't know how well these medications work for people with both conditions, or what the long-term risks might be. The key takeaway is that duloxetine at a standard dose may be considered before other antidepressants for chronic pain, but treatment should always be tailored to the individual. More research is needed to understand long-term effects and safety, and a person-centered approach remains essential in managing chronic pain.